is how will we know when we've hired enough contact tracers, given the fact that it's a little unclear exactly how many we have currently. The lack of clarity comes from the distribution of our workforce across the state. We have 35 districts, we have 129 local health departments. Each of those departments are facing a different level of cases in their jurisdiction, and they ramp up and down according to what's happening in their localities. So at any given point, I couldn't just tell you exactly how many people are working on contact tracing in Louisa unless I called up the Louisa Health Department and asked them who's working on it that day. I do know, however, that it's in the hundreds. It's probably 200 to 300 people who are doing that kind of work. And we also know that we need about 1,300 or so in order to hit that 15 per 100,000 population. We can definitely figure out exactly how many people we hire as we ramp up, because that's going to be a special effort requiring working with our workforce director and others to really make sure that we hire people appropriately across the Commonwealth, ensuring that we have them in rural areas and Black and brown communities, that the workforce represents the people that they are working with in those communities, and other things. So we will know when we've hired that number. And then we will be tracking the metrics that we've told you about, and that will give us an idea of whether or not we have enough people on board for tamping down any increased incidence in the disease. And that's our endpoint. Because boxing in the spread of the disease is the whole purpose of the contact tracing, and if we're not boxing it in, then we need to do more.